So good morning. As mentioned, I am the account director at Datadog in support of our HHS customers, and absolute pleasure to be here this morning. Privileged to share the stage with such distinguished federal healthcare leaders. So today, what I want to talk to you guys a little bit about is what we're seeing from our clients with regards to the importance of customer and digital experience management. Over the past year, I'd say in lieu of M2322, there's been a tremendous amount of interest to capture the data, metrics, and analytics around how consumers are coming to these federal websites and services. And the agencies really want to take this data and help modernize the way they deliver 21st century applications. So a little bit of an example, we were working with an HHS entity a few weeks back, and they have a translational science program. So essentially think consortium of back-end data sources, all sorts of biological markers, clinical data, patient history, and researchers and scientists can query, right, this back-end system in order to advance their hypotheses when it comes to their clinical research and their tests. So it's essentially a force multiplier for innovation and speeding up discovery. And the customer said, look, a few years back, right, a scientist may wait 10, 15 minutes for that query to build the results. He's like, but now with more users, more power users, citizen data scientists, like they don't want to wait 5-10 seconds, let alone 5-10 minutes. They think the application's broken. And our challenge is how do we capture the internal data and telemetry for us to understand where these bottlenecks occur, where the degradation in service occurs in order to deliver a more optimized service. And I think that sentiment is really at the heart of CX, right? And what we see. It's how do I get my hands around my internal system and what good looks like in order to make sure my customers experience good. So a couple pieces here, good and bad, right? I'll say the bad is CX is hard. Forrester comes out with a customer experience index report every year. And even on the commercial and enterprise side, there's only a few organizations doing it really, really well at the top. And then you transition to the public sector and you realize there's complexities around legacy systems, multi-cloud environments, IT ecosystem organizations managing different things. It's difficult to get all on the same page. However, good news is in that same Forrester report, it's saying 64% of CX executives are seeing increases in funding, and industry and technology companies are continuing to bring new solutions to market to drive the CX mission forward. So whenever we're talking about, a pillar or a focus area, there's typically themes, right? So the three themes that we see on a regular basis are these. One, a pervasive word of being proactive, right? IT organizations want to identify bottlenecks, degradation, and outage and notify the end users before they notify them, right? The second piece is really around live analytics. They want to be able to capture what the end user sees when they come to their sites and services and be able to replay those sessions for their development teams. So their DevOps teams can see, hey, when we click on this and there's spinning or there's degradation, what code is that tied to? What backend service? What infrastructure? So they can improve their DevOps cycle. I'd say lastly, the things we see, not so much on optimization or performance, but more around what we call product analytics. So think human-centered design. I have a front-end portal, right? I have a service, and where are my heat maps? Where are the things that my customers click on the most? That way, when I deliver a new service or a release or data that I really want my customers to access, I know where to put it in the greatest likelihood to get traction. So I'll give you an example of where this has been done really well. National Cancer Institute has a program called HALO, and HALO is a leading digital analysis platform for quantitative tissue analysis in the field of digital pathology. It's a lot, right? What it really means is that there are healthcare institutions, pharmaceutical companies that will access this tissue analysis platform in order to advance their studies in the fields of oncology, toxology, neuroscience. And in lieu of the Cancer Moonshot program and all the funding that we dedicate to cancer research, it's imperative that this system is highly available and highly scalable. So their IT organization set out, right, to have an end-to-end observability experience where they can capture what the end user sees, what the external end user see, and mapping that back to the underlying infrastructure and code to really establish a baseline, KPIs, SLOs, in order for them to go back to what we talked about, being proactive, identifying where degradation happens, and being able to get in front of that for the end user. So what I'd leave you with is, a lot of the data that we have within HHS, VA, DHA, it's not commodity data. I mean, in some regards, it is the lifeblood of how we as a nation develop breakthroughs and develop new solutions for our healthcare community. So for industry and the partnerships that we have, we look forward to continuing to work and help drive CX and DEM missions forward. Thank you.